When you sleep tonight, your brain spends about half the night flushing out the proteins that build up to cause memory loss. There's a system that does this. It's called the Glymphatic System, and it works measurably better in one specific sleep position. Most adults sleep in the worst possible one. Here's what the research actually shows. Start with the system itself. In 2012, a team led by Iliff published in Science Translational Medicine and gave the brain's waste clearance pathway a name, glymphatic. Think of it as the brain's plumbing. Cerebrospinal fluid flows along the outside of blood vessels, washes through the brain tissue, and carries metabolic waste out, including the protein that accumulates in Alzheimer's disease, amyloid-β. The next piece is when the system runs. In 2013, Xie and colleagues published in Science. In mice, during sleep, the space between brain cells expanded by about 60%. That expansion lets cerebrospinal fluid sweep through the tissue at a much higher rate. Amyloid-β clearance roughly doubled compared to wake. The brain's wash cycle runs on sleep. Not on rest, not on lying still with your phone, on actual sleep, especially deep slow-wave sleep. A 2019 paper in Science Advances by Hablitz showed the influx of cerebrospinal fluid tracked specifically with EEG delta power. The deeper the sleep, the harder the system runs. Now the position. In 2015, Lee and colleagues, including Benvenisti and Nedergaard, published in the Journal of Neuroscience. They imaged anesthetized rodents with contrast-enhanced MRI in 3 different positions: supine on the back, prone on the stomach, and lateral on the side. The lateral position cleared significantly more glymphatic tracer than supine. Prone was the worst of the 3. The side position cleared the brain measurably better than sleeping flat on your back and dramatically better than sleeping on your stomach. This is rodent data, so the honest framing matters. Nobody is telling you a rat study proves side sleeping prevents dementia. What the research suggests is this: the brain's waste clearance system, which has been linked to amyloid removal, works most efficiently when the body is on its side. The 2021 IDE paper in the journal Brain used MRI in humans with intrathecal tracer and showed that even one night of sleep deprivation impaired molecular clearance from the human brain. The system is real in humans. The position dependence has the strongest data in rodents. The mechanism, driven by arterial pulsations along perivascular pathways, as Mestre showed in Nature Communications in 2018, is conserved across species. There's also a human observational signal. A 2019 study in the Journal of Alzheimer's Disease by Lewandowski used polysomnography on community-dwelling adults and found that people with neurodegenerative disease spent significantly more time sleeping on their back than controls. Observational, not proof of direction, but the signal lines up with the rodent imaging. Why does the side position win? The current best explanation is geometry. When you're on your side, the brain's perivascular drainage and the neck's lymphatic outflow line up in a way that lets cerebrospinal fluid move out efficiently. When you're on your stomach, the neck twists and the airway compresses. On your back, the airway does better than prone, but the flow profile through the brain is still less efficient than lateral. So, the headline: the brain's waste clearance system runs hardest during deep sleep, and the position the research most strongly supports is lying on your side. Stomach is the worst measured option. Back is in the middle. That is the science. The protocol comes next.
Here's the protocol the research actually points to. Sleep on your side. That is the headline finding from the Lee 2015 imaging work, and it is the position that aligns the brain's drainage geometry with the way the glymphatic system was designed to flush. If you only do one thing tonight, that's the one. Now, which side? The rodent imaging didn't show a strong left versus right difference for glymphatic clearance, but there are practical considerations. The stomach empties to the right, so left side sleeping can reduce reflux for people prone to heartburn. The lymphatic system also has a slight left side drainage bias through the thoracic duct. For most healthy adults, either side works. Pick the comfortable one. If you have reflux, lean left. Pregnant women past about 20 weeks are typically advised to sleep on the left, but that's a conversation for your OB. The next layer is keeping the side position through the night. Most people start on their side and end up rolled onto their back by morning. A full-length body pillow tucked along the front is the simplest fix. It gives you something to wrap around and holds the spine in side alignment. A pillow between the knees keeps the hips stacked and prevents the lower body from twisting open and pulling you onto your back. For people who really can't stay on their side, the old tennis ball in the back of the shirt trick still works. So do positional sleep shirts designed for sleep apnea positional therapy, which is the same intervention applied to a different problem. A note on the back position. If you cannot sleep on your side, the data suggests a slight head elevation may help. Lee 2015 also tested head-up tilt and found it modestly improved clearance compared to flat supine. A small wedge under the upper body or an adjustable bed at around 4 to 12 degrees is the conservative version. Not so high that you slide down, just enough to give the venous and lymphatic outflow some assistance from gravity. A few people need to do something different. If you have obstructive sleep apnea, position alone is not the treatment. Some patients are positional, meaning their apnea is much worse on their back, and for them, side sleeping is part of the clinical recommendation. But the diagnosis and the protocol need to come from your sleep doctor, not a YouTube video. If you have a shoulder injury or chronic shoulder pain, side sleeping can aggravate it, and a thicker pillow under the head plus a small pillow hugging the shoulder usually helps. If you're pregnant past about 20 weeks, follow your OB's guidance on left side sleeping. If you have any heart, lung, or musculoskeletal condition that affects how you can lie down, talk to your physician before changing your sleep setup. The full picture. The brain's waste clearance system runs hardest during deep sleep. The position the research most strongly supports is on your side. Stomach sleeping is the worst measured. Back sleeping is in the middle, and a small head elevation helps if you must use it. Use a body pillow and a knee pillow to hold the side position through the night. Prioritize the basics that drive deep sleep in the first place. Cool, dark room, consistent bedtime, no alcohol before bed, no screen in your face. The position is the lever you adjust on top of those, not a substitute for them. If you want the meditation version of the brain protection conversation, the practice that's been shown to change brain structure and stress response, check out our video on the meditation protocol most people skip. The link is in the description below. This is research, not medical advice. Talk to your doctor before changing anything.